Hi, this is Brian Kim. I'm going to share with you episode number 2 in the surgical instrument review series. And this is the Epsilon Shepard Capsule Polisher and Koch-Singer Polisher. It's a double-headed polisher, EP81K. And I've been using the original first generation Singer sweep in order to polish underneath the Anterior capsule surface. It works okay, but I just noticed it doesn't clean the capsule as much as I'd like. And so as I've been doing this analysis for the reviews, I was told that this is a very popular anterior capsule polisher. And so I wanted to go ahead and give it a try. And so this is my evaluation of the Shepard Capsule polisher and Koch Singer polisher. So as you can see here, this is the Shepard Capsule polisher side. It's a ring, and it's a right-angled ring with a straight handle. And you can see there's a little bit of a vertical dimension to the ring, and there's like a little bit of a sharp edge, or the outer edge of it sticks out more, and it tapers inward as it goes towards the center. And it tapers down so that there's actually a little bit of a sharp edge to the external portion of the ring. And so you can see it has to go through the main incision because it's a little bit on the big side. You can't pass this through the paracentesis like the Singer sweep. And it's a little bit of an awkward feeling. It's not a feeling that we're used to with cataract surgery. You have to stick this pretty big thing through the main incision, but it's really, really good at sweeping the subincisional capsule. And so you see as I'm doing that, a little bit of cortex starts to come up. So it's really good at snagging and hooking because it does have that sharp edge. It does a really good job cleaning that lens epithelial cells. You can see all that stuff coming up. And you're able to twirl it within the eye, and I'm able to sweep on the left side and then the right side without having to come out. But again, it's a little bit of an awkward feeling. It's mainly because I'm not used to it. And this is the Koch-Singer polisher side. You can see it's got an angle to it. And I'm going to go into a bit higher mag, and you can see on the sweeping side, there is a sharp edge to it. Now, when I say sharp edge, it's not a cutting sharp edge, but it's sharp in the sense that it does a more effective polishing. And again, this is in contrast to the old generation Singer sweep that I have that doesn't really have as sharp of an edge to it. Another thing I've noticed is the paddle is actually much larger than the paddle that I have on my Singer sweep as well. So you can see the angle allows really thorough and a wide area of sweeping of the subincisional side. But honestly, that Shepard capsule polisher does a really great job on its own. So that's the end of the case, and you can see the anterior capsule is really very, very clean. That was one thing I was really impressed with this polishing instrument. I was able to polish subincisionally, polish all the way around. The Shepard polisher was very thorough in polishing, but if you wanted to kind of do a little bit extra polishing, you can use the Koch Singer sweep as well to polish the subincisional area. And that's the thing about that one, it's really angled for that space, the subincisional space for the Koch Singer polisher. So this is the next case. You can see I'm filling the eye with some more viscoelastic. I'm showing the instrument once again, and this time I'm actually going to show the handle. You can see it's got ridges and it's a rounded handle. You need to have a rounded handle while you're trying to sweep. It's just a better design because as you're trying to sweep around, you have to be able to twirl the handle in your fingers, and by twirling the handle, you can actually manipulate and sweep more effectively with both instruments, the Shepard side as well as the Koch Singer side. So go ahead and start sweeping. Again, just a slight gentle upward pressure as you're sweeping. And I'm able to start on the left side and then twirl it to the right side without coming out. Again, it's a little bit big, so it's a little bit intimidating when you're first using it. But I think the strength of this instrument is The fact that you can go into the subincisional space pretty confidently, it is right angled, and it's because it's got that big round component to it. It does go into the subincisional area a little bit deeper. But again, you have to go through the main incision, and it's just a little bit awkward if you're not used to the movements. So again, this Singer Koch sweep goes into the subincisional space, and you can polish it a little bit extra if you feel like you need to do some more, because that sweeping maneuver is a little bit more thorough as far as polishing the subincisional space. And so that's the end of this case. You can see again how clean the anterior capsule is. Again, this is in contrast to the sweep that I have, where I would still see some remnants of lens epithelial cells despite really aggressive polishing with the IA tip as well as my Singer sweep. And I believe it's because of that sharper edge design that has come out with the newer iterations of the sweep and the polisher here. Really, really beautiful looking capsule. All right, so this is the next case. I'm doing the same thing. You see you have to kind of enter a little bit at an angle and then straighten out. So as I'm sweeping, you're twirling it in your fingers, so it kind of sweeps a little bit upward as you're going around here. In all these cases I'm showing in this series is all the cases that had really big pupils. And that's just simply to be able to illustrate and highlight how well the polisher does clean underneath the anterior capsule. So this is probably because of my technique, just not knowing how to use the instrument. As I'm doing this, I'm noticing I'm pushing the eye away from me quite a bit. And I just think that's because I'm just not used to the maneuvers with these instrument with the, at least the Shepard Capsule polisher. So here's the Koke Singer side of it now, polishing the subincisional space. Again, does a really nice job cleaning the rest of that up. And so this is the end of that case. Again, you can just see how nice and clean this capsular bag is. There's just very little signs of lens epithelial cells. Sometimes you could see some frosted areas where I did my best to try to polish with my Singer sweep, but it just wouldn't clean it as well. And again, that new design where there's a sharper edge to it, I think does allow a much deeper cleaning of the anterior capsule of the lens epithelial cells. This is another example, starting subincisionally and twirling as I go. Another thing that I was worried about was, since this is so big, what if I accidentally grab the posterior capsule and cause a tear? And so I did inject some more viscoelastic, cohesive viscoelastic to fill the bag before I started sweeping, but I do that routinely anyways. Obviously, because it's so big, I think it's even more imperative that you have a really expanded bag when you're manipulating this very large instrument inside the capsular bag. But thankfully, I didn't cause any problems with the posterior capsule. I didn't encounter any problems there. And so as long as you follow those principles, I don't believe it's going to be a major problem. But it is a little bit intimidating if you've never used this before. And I still do the INA when I finished with putting the lens in. I do sweep and polish underneath the anterior capsule with the INA handpiece as well. So I've already done quite a bit of polishing before I get to the sweeps here. So again, look how clean the anterior capsule is. It's just really, really pretty. And I do think that this is helpful for helping with inflammation and PCO, and just helps prevent capsule fibrosis and capsule phimosis in the future. So this is another case, starting subincisionally again, sweeping and turning and rotating it as I go. So like I said, it's just a little bit of an awkward maneuver. Still not quite used to using this instrument, and the motions and the muscle memory I haven't developed. And so I'm quite a bit off the screen here as I'm doing this. It's because I'm pushing against the wound when I'm doing it. Since it's so big and bulky, you just have to make sure you don't snag the capsule as you're trying to come out with that ring, and you don't want to tear the capsule as you do it. And so again, that's the end of the case here. And again, you can see how clean it is, not only anterior and in front of me, but also subincisionally. Each of these cases, the subincisional anterior capsule is just really, really clean. And that's really the kind of the hardest part to get to, is that subincisional area. So with my Singer sweep that I was using, I'm able to polish pretty well, but because of the I&A handpiece, I'm able to polish in front of me really thoroughly as well. But that subincisional area, I'm really limited to just the sweep to polish. And so if with the original one that I have, the first gen Singer sweep, if I can't get all of that lens epithelial cells off in the subincisional area, then I really don't have a whole lot of options. But again, with this newer generation double-headed Shepard Capsule polisher, as well as a Koch-Singer polisher, because of that sharp edge, it does really a nice job polishing around. Like I was saying before, the Koch-Singer polisher component, that paddle is bigger on this one than on my original Singer sweep. And so I think having that bigger paddle as well as that angle, the angle allows really kind of a deeper and more thorough sweeping of the subincisional area. So again, that's the end of the case. And again, you could see all of these cases with big pupils, you can see how thoroughly clean the anterior capsule edge is. After I do all this sweeping, I just marvel at how beautiful the eye is. And it just makes me feel good that I swept all of those lens epithelial cells out and try to give the patient the best result. I've used the example, it's like if you go into someone's house, you want to be able to leave it better than the way you found it. It's like, vacuuming in the house and removing all the dust bunnies around the corners. You just want to, before you leave, just do a great job in cleaning up everything. So you can see I'm polishing again, going around. And you can see as I'm doing this, I'm getting a little bit better at keeping the eye centered. And I'm doing that little twirling motion in my fingers to polish with the Shepard polisher. And that's the end of that case. And again, a very nice, clean anterior capsule edge. And so this is the Shepard Capsule polisher and Koch-Singer polisher. It's a double-headed polisher with a rounded handle. The rounded handle is important to be able to twirl the instrument in your fingers. It is made of titanium, made by Epsilon. And I really think that this instrument does a great job in achieving your goal of being able to polish underneath the anterior capsule edge. I do think polishing underneath the anterior capsule edge is important because it does reduce inflammation. I think it does also help reducing PCO, as well as preventing capsule contraction and phimosis. And more importantly, nowadays when patients are having refractive cataract surgery, you want to be able to remove the lens implant if necessary and swap it out with a new one. When you polish, there's a lot less capsule fibrosis to the lens implant. My only criticisms of the instrument is that Shepard polisher is just so big and round. It's a little intimidating. The movements are foreign and awkward because I've never used that instrument before, but it does do a great job in polishing, and it's certainly far better than what I've been using with the Singer sweep, primarily because that sharp edge design. I think that over time, as they've changed and modified these instruments, that sharp edge design is so important, and that is why you have such a clean anterior capsule at the end of these cases. So I hope this was helpful to you, and I thank you for your attention.